Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, March 24th, 2022, and we are here, as always, to answer your COVID questions. Yes, we have been doing it for more than 2 years. Yes, we will continue to do it for as long as you have questions. And honestly, I've gotten a number of questions in from people. Is this something that you'll continue in post-COVID? Not about COVID, but about other health initiatives, other health things that the department is doing, and the answer definitively is yes. It is more likely, we'll be on the Chicago Department of Public Health channel, so if you don't follow the Chicago Department of Public Health on Facebook, on Twitter, please do. If you're interested enough to be watching this, I think there's probably content that you would like that we create about COVID, but also about a lot of the other work we do. We've been doing a lot around mental health recently, substance use, etc. So as always, you'll be able to put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We will start with a look at our data dashboard, look at some slides, and then jump into your questions. So we'll start with the dashboard, chi.gov/COVID-. And if we look at this, you see a mix of red and green here. Red means that we are seeing some increases. Not unexpected, but some gentle, at this point, increases. So you can see we're averaging about 170 cases a day right now. That is still very good, low risk by every metric, but it is up from 137 on average a week ago. We're averaging 9 hospitalizations a day, which is down under 10 for the first time. And this is new Chicago residents being hospitalized each day with COVID. That is down to really the lowest point since last summer. Deaths also, you can see, are still coming down, averaging finally again less than 1 death per day in Chicago residents from COVID. So that is also back down to last summer levels. And both of these are reflections of coming off that Omicron peak in a lot of ways still. And these have been stable and declining. Vaccination numbers are also down. Not a surprise, given that we know a lot of people are motivated to get vaccinated when they are seeing people around them get COVID, or there's a surge, or they're concerned. But I do want to use this time when COVID rates are relatively low to encourage people to get up to date with your booster if you're not, to get that second dose if you never got it, or of course to get vaccinated now if you've been waiting until more than 5 billion people around the world got vaccinated. Testing remains quite good, about 22,000 a day. That is more than 3 times what we were doing last summer. And so it's in that setting. Sometimes people ask, what about you're not catching all of the tests of people who are testing at home? That is true, but we are capturing 3 times the number of tests that we were doing last summer at the same case rate. And so that's part of how we're confident that things are flat with slight increases. I think the increases will continue, but we'll be keeping an eye on it. And then similarly, our positivity at 0.9% is beautiful. Really, the goal, WHO says under 5% is good, and we consider controlled under 2%, but again, last week we were at 0.7%. In Europe, where things are really surging right now, there are positivities of 30, 40, 50, 60%, in some cases even higher. And that is a lot of cases, and then we know when positivity is that high, positivity is as much about are you doing enough testing, that there are a lot more cases than are being picked up in the formal testing system in those countries. But the good news is that those cases, because these are highly vaccinated settings, almost all of them, are not translating into significant hospitalizations, deaths, or severe outcomes. So the vaccine makes a huge difference, but still there is some concern. So let's take a look at some slides here. We put some of these together. Some of them we shared at our press conference on Tuesday. Some of them are based on questions that we received from you. So around the world, as you already heard me say, making good progress. More than 5 billion people have had at least a first dose, more than 11 billion vaccine doses around the world. But we have seen more than 6 million recorded deaths from COVID. We'll be passing the 1 million mark just here in the U.S., probably not too long from now. And you see in dark purple there in Australia and parts of Asia, parts of Europe, those are countries that have very, very high case rates right now. And so as we've often said, vaccines are not the whole story, but they do make the biggest difference, especially in preventing severe outcomes like hospitalizations and deaths. This is the national picture. Chicago's got a rate about half of Illinois, and Illinois right now is averaging the same as the rest of the country. You can see our hospital and ICU numbers are stable right near the bottom edge of lower transmission. You can see right now across Chicago hospitals, there are 117 people in non-ICU hospital beds with COVID and another 24 in ICU beds with COVID. Really glad to see the numbers that low, even though, of course, you know, for those 141 people and their families, this is a real health crisis, and I don't want to underemphasize that, but we are seeing these at the lowest rates that we've seen. The travel advisory that we released on Tuesday, we shared that starting tomorrow, we actually will be transitioning from this to using the CDC community risk levels. So this was what we had shared in the traditional way we've been doing this for almost 2 years, which has just been based on case rates. And so as a reminder, the states in orange have more than 15 cases per 100,000 per day, and the states in yellow are underneath that. And our concern are the states that are orange. Just wanted to highlight, though, that where the whole country is doing well, and you can see on the bottom right there that in Chicago, for example, if you go back 10 weeks, we've seen a 97% drop in our case rate. Illinois has seen a 96% drop. The U.S. has seen a 96% drop, really dramatically better. And as a reminder, the CDC's COVID-19 community levels put every county in the U.S. as either low, medium, or high. Low means low levels of severe illness, limited impact on healthcare system, relatively controlled cases. Medium means we're seeing some impact on the healthcare system, more people with severe illness. And high means there's a high potential for healthcare system strain, high level of severe illness, and or high number of cases. And so if you look across the U.S., really, there are very few counties that are still at that high risk. And so we've made a decision. The CDC didn't have a tool like this for a year and a half, where you could easily every week say what is happening at a county level across the U.S. One of the reasons here in Chicago we were doing those calculations for states is I think it's really important for people to understand what your risk is here, because risk really is local. All epidemiology at the end of the day is local. But if you're going to be traveling, I want you to know whether or not you need to be more or less concerned about COVID when you're traveling. And so, again, you can see if for most of the U.S., COVID is in very good control. There are some counties here that are yellow, and we would recommend at least thinking about wearing a mask in public indoor places if you're going to one of these counties that's yellow. And if you're going to one of the counties that's orange, the CDC and CDPH recommend wearing a mask in indoor public places. We also are recommending that people who are over 5 but unvaccinated not travel to counties that are orange. And if they do, to follow the CDC guidance and quarantine and test upon return. But you can see all of Illinois is currently in green. And we are going to be really each week referring to this map. We'll be likely calling out specific counties if they are in red in the Midwest here. And then the states that include counties. But we want you to take a look if you're going to be traveling, just so you know what the risk is, and so you can be prepared. Lots of questions about BA2, and just as a reminder, we test a lot of samples from all over the city for variants every single day. and that data goes into a database that is shared nationally, internationally. And in both Chicago and in the Midwest, what we've seen is that Omicron BA2, which you see in the light purple or pink here, is just over 30% is the estimate of the cases. The rest are the original Omicron, B1 or BA1. And you can see that each week now for about 6 weeks, we've had a doubling of that BA2. And I do expect that really by the end of March, we will be at predominance, meaning the majority of cases here in Chicago and in Illinois will be that BA2 variant. BA2 is more contagious, more infectious. That is why it outcompetes the original Omicron strain, but we don't have any evidence that it is making people sicker than regular Omicron or other forms of COVID. And there is good evidence that if people were infected with Omicron, the first version of Omicron, that they retain at this point protection, more than 90% protection against BA2 infection. And we've been watching a lot what's been happening in the world and in the US. Across the whole world, the predominant variant now is that BA2, that subvariant of Omicron. And you can see in the northeastern US, where those pie charts are more pink than purple, in New York, Connecticut, Maine, et cetera, those regions also already have a BA2 predominance. Again, you can see here we're about a third. The US overall is about 35%. And so similarly on the East Coast, there have been some increases in COVID cases. We're watching very closely. And, I do think we're going to see at least a little bit of an increase here for sure with BA2. But the main question is, will this turn into a major surge like we've seen in some other parts of the world? We're up to 46 zip codes in blue here that have at least 70% of their age-eligible population having had at least a first dose, so that's great. We have 37 zip codes in blue here with at least 80%, which is even better, makes me happy. And we have 14 Chicago zip codes that I would say really have that level of protection that is ideal for COVID vaccine coverage, with at least 90% of those who are age eligible having had the first dose. Last week we had called out the Loop near North and South Side, Lakeview, North Center, et cetera, Rogers Park and West Ridge up top, and then 60629 down in the Southwest. New this week, we saw 60639, parts of Austin, Avondale, Belmont Cragen, Hermosa, Humboldt Park, and Logan Square up in the Northwest. So congrats to them. Really good to see continued progress. And every day, we are putting a few thousand COVID vaccines in arms. We also announced a couple of changes that are coming as of April 1st. So first of all, our very popular and successful Protect Chicago at Home program, which, as a reminder, brings vaccines free of charge, regardless of income, immigration status, insurance status, et cetera, no questions asked, brings it to your home. We've been doing it 7 days a week, 8 a.m. to 6:30 p.m. As of April 1st, we're going to be dropping that to a 4-day-a-week schedule. We looked at the data, and we have the most appointments and the most interest in our weekend appointments and the appointments early in the week. So we'll be offering appointments Saturday, Sunday, Monday, and Tuesday, 8 a.m. to 6:30 p.m. We see enough demand and we have to go back to more days, we would consider doing that. But for now, we're going to a 4-day-a-week schedule. And I want to give a shout out to our amazing team at the call center. When you call 312-746-4835 7 days a week, they have been answering calls. They've either taken or called out nearly 500,000 calls in a year. And right now, when we have fewer calls coming in, this is when they work as a team on reaching out around different priority areas or populations. We've worked with calling CPS families. We've worked with calling seniors. We've worked with calling our highest risk Medicaid recipients who are on devices that they need electricity maintained for to make sure that they're vaccinated. And so right now, they are calling about 40,000 Chicagoans who, per our records, are due for their booster dose and haven't gotten it, or got a first dose and never got a second dose, because we really want folks to get up to date. The WHO has also made a recommendation worldwide for that third dose, that booster dose, and we want people to get caught up right now. So they're doing some of that. And to that point, if you should get your COVID booster, anyone over the age of 12, if it's been 5 months since your Pfizer or Moderna series or more, or if it's been 2 months since your J&J or more. So there's a lot of folks here due for their booster, and when we look at some data here in Chicago, around the world, we see that booster having extra and important protection against especially the severe outcomes, hospitalizations and deaths, and that becomes more important as people get older. So especially if you know anybody who's older or has any underlying condition, please make sure they've gotten that booster. We also will be pulling back a little bit on our financial incentive program. So just as a reminder, we've been offering $50 vaccine incentives to people getting their first or second dose of vaccine at all of our CDPH settings, our at-home programs, CPS clinics, and then our Healthy Chicago Equity Zone lead events, which are with our community partners around the city. But you may have heard, and I'm happy to take questions about it, that there are some concerns about COVID funding at the federal level, where there has not been an agreement by Congress to continue to fund some of the COVID needs, particularly around making sure that people who are uninsured could get reimbursed for things like vaccination or testing or COVID care. Obviously, here in Chicago, we want to make sure that people who are uninsured can always get a vaccine. There is no world in which we would not sustain that. But if we're needing to sustain some of that, for example, at the city level, we are conserving some resources. So starting April 1st, only Chicagoans living in the 15 zip codes in blue here, and those are our 15 zip codes that are still less than 70% fully vaccinated among those who are age eligible. Only Chicagoans living in those zip codes will be eligible for those $50 gift card incentives. And we know the incentives have been important. We know people, have to make time for it, sometimes are adjusting from work, having to pay for childcare. It can just be one more thing that for some people can really make a difference in terms of deciding to get that. So if you or somebody you know has been waiting to get a vaccine and you do want to be eligible for those $50 vaccine incentives and you live in one of the other zip codes, please make sure you get this done before April 1st, but specifically for the at-home program, we will honor incentives citywide for anybody that gets their appointment scheduled by this Friday, tomorrow, 3/25, even if the appointment itself happens April 1st. So if you live anywhere in the city and you haven't gotten your first or second dose, give us a call and we'll get you scheduled for an at-home vaccine and that $50 gift card. But after April 1st, otherwise, this will be limited to people in those zip codes where we still have the most room to grow and the biggest need in terms of the fewest number of people who have the best protection against COVID. There will be some other settings, for example, some of the work that we do with CPS in highly unvaccinated areas, or some other special events that may have this. But by and large, this will be the change. Just wanted to remind you that nothing has changed around isolation and quarantine. If you catch COVID, regardless of your vaccination status, you must stay home for 5 days. If you're feeling good, your symptoms are resolving by day 5, yes, you can leave your home, but you must continue to mask while around others for days 6 through 10. That has not changed. There is no indication it will change anytime soon. Also, just a reminder that the second round of the free federal at-home COVID-19 tests are available. So if you ordered a couple of months ago when we were in that surge and it was really hard to find at-home tests, you go to covidtest.gov, you put in your contact and shipping information, place your order, and then the first time around it took, for me, it took actually a few weeks for my 4 free at-home tests to arrive, but this time it took about 2 days. And so I would love Chicagoans right now, when we are not surging and there is less demand around this program, to order those free at-home tests and have them available. We are also thinking about, are there ways that we can have some additional, potential stockpiling of some of this in case of a potential surge in the future. But something you can do right now is order some of those and make sure everybody you know has also ordered them. You can put them on the shelf if you don't need them now. And anybody who doesn't have internet can call 1-800-232-0233. And then finally, early treatments. We keep emphasizing this, that if you test positive for COVID-19, there are medications that are available and effective at keeping you out of the hospital. One of the oral medications, the Paxlovid, cut the risk of getting hospitalized in people who got COVID and had underlying conditions or otherwise high risk, cut that risk of getting hospitalized by 90%. But you have to take these in the first few days of infection. So if you test positive and you are over 65 or you have underlying conditions, please call your healthcare provider right away. Tell them you tested positive, see if they recommend getting any of these treatments. These are available across Chicago, and we can help your doctor, if necessary, in terms of how to make sure that you can get it. But you need to see a healthcare provider. You cannot just show up at a pharmacy. You cannot just show up at an IV infusion center. A provider has to look at your medical history, look at your other medications, and make a recommendation of whether or not you should take these medications. These are available. And then finally, chai.gov/COVIDVax or 312-746-4835. And let's get into your questions. All right. Good number of things coming in. So let's start with maybe the travel question. Carly J on Twitter says, I'm trying to plan some travel for the summer. What's the updated guidance on travel now? So first of all, if your planned travel is in the United States, we will continue to every month be sharing out this map. It is on every week be sharing out this map. It is on the Chicago Department of Public Health website. It is on the CDC website. You can look at different areas of the country by county to see if the area that you're planning to go is medium risk or high risk for COVID. There is nobody is going to stop you, just to be clear, from traveling anywhere in the United States, regardless of vaccination status. But we recommend strongly that people who are unvaccinated but eligible not travel to areas that are orange. And if you do need to travel, anybody who needs to travel to an area that's orange, please, please, please wear a mask. They really are very high risk, and their hospital systems are stretched. It's not a good place to get COVID if you're traveling there otherwise. If you are traveling internationally, the CDC keeps up to date its guidance for travel to other countries, depending on surge. But regardless of where you're traveling, here's how I want people to think about this. Before traveling, and I don't care if you're driving to Wisconsin or you're flying to Ireland, before traveling, make sure you are up to date with your vaccines and your boosters. There are starting to be some settings, not really in the US, but that might even require boosters. Plus, it gives you the best potential protection. Get up to date before you travel. Do it now. Bring your vaccine card. Take a picture of your vaccine card in case you lose it. If you want to use one of the apps that are increasingly available, you can, but don't travel anywhere without that card, because there are or proof of it. There are places that continue to require it. And if you're going internationally, that's really true. You definitely need to have it. Also, I would encourage, I'll tell you, when I travel, again, even a short travel, I pop one of those at-home COVID test packs right in my bag with me, because if I start having symptoms when I'm traveling, I don't want to worry about where do I get a test. I want to be able to, take a test right away and have it. So a good reason to order some of those, and I would encourage just traveling with them. And then finally, obviously, bring a mask. Right now, masks remain required on public transportation in the United States everywhere. That includes Ubers and Lyfts and subways and airplanes and trains and buses. And regardless of whether it's required, you may be in settings where you'll want to put one on. So I would encourage you to bring them. But otherwise, if we remain, I am a big fan of when things are in good control, taking advantage of that time. So I am planning to hopefully take some vacation this summer. I am planning to do some traveling. I will definitely be watching what the COVID numbers are here, because that's my job, and where I'm traveling. But I do think, I'm feeling pretty optimistic that if you are up to date with vaccines, then you are in a good place to be able to travel. And, that wasn't something we could say in the pre-vaccine world. All right. Let's take Mindful Monkeys on Twitter says, how do you explain the Coonley outbreak? And for those who don't know, the Coonley is an elementary school that has had some transmission. And has had an outbreak. And the person is commenting, it's a relatively highly vaxxed school, but it's not a highly masked school. I'm not going to comment on the masking piece, but I do know it is a relatively well-vaccinated school. And I do want to say, Mindful Monkeys, I'm just reading the rest of your question here. Please explain how COVID damages heart and brain as research has shown. So I want to just make sure, if we're talking about sort of COVID or COVID vaccine here, let me take the first part of your question and then secondly, the second part. So on the first part, COVID is not gone. I don't think COVID is going to be gone anytime in the short time frame here. Masks remain a tool that we will use and always have used when there is a setting that we have any concern about. So in the same way masks remain required in healthcare settings and long-term care settings, very high risk, congregate where people sleep overnight type settings, we also absolutely continue to make mask recommendations or even requirements for settings where there may be some risk. And so Coonley is not the only school where we have seen multiple cases of COVID or made recommendations about returning in certain classrooms or certain settings in a short-term way to masking. We've had at least one of the schools in the Archdiocese, we've had at least one of the private schools. It is not unexpected. And if we are seeing multiple cases in a cohort, in a classroom, in a team, etc., we default to let's put the mask on while we do the investigation and figure it out. I will tell you, Coonley is no different from a lot of the other school investigations that we're doing, that there are a lot of kids, and this is a good thing, who are gathering outside of school. There's birthday parties that all the kids are coming to. There's dances, there's activities. This is good and appropriate, and I want to encourage people to, as long as kids are vaccinated, be doing some of these important things for social and emotional. But if we see an outbreak, yeah, we put masks on, not forever, but while we are, while we're assessing the situation and making sure that we're not inadvertently causing additional spread. Because if there's been exposure in that setting, the mask helps that if there's a child who is infected, even, without symptoms, has the negative test, etc., in the days before, they have the potential to spread in that time period. So it's kind of like, I heard an analogy that I liked. I think about the mask kind of like an umbrella right now. You don't need to wear it all the time. It is not raining. It is generally good weather. But I carry my umbrella with me, right? And if I'm in, so there's an afternoon squall, there's some, there's sort of a higher risk moment or point, like I want to have it with me and I'm going to put it up, not forever, but to help protect myself. And so masks in some ways are like that. The umbrella works right away as soon as you put it up. The mask works, right away as soon as you're putting it on. And they remain tools that we use to control potential spread. And to the second part of your question, so explain how COVID damages heart and brain. So I want to be clear, COVID, just that you're talking about COVID disease and not COVID vaccine, because COVID vaccine, not evidence about, damaging brain, et cetera. If you're asking about COVID, I'm guessing this may have to do, if you're asking about kids, first of all, there are some kids, especially before vaccination, who develop this MIS-C, this inflammatory response, which was rare, but did cause some really serious outcomes, including sort of organ inflammation and problems. There are kids overall are less likely to have, symptoms and have severe outcomes, but there have been some kids who have had the severe outcomes, who have been hospitalized, a very small number who have died from COVID. And one of the reasons that the vaccine, of course, is so strongly recommended at this point for the 5 to 11-year-olds is that the protection is very good against those kinds of severe outcomes. Even if, we've seen in both children and adults that there are more breakthrough infections with this Omicron. But the vaccine is the number one thing that turns this from a disease that, that we worry a lot about the outcomes to one that can be more mild. Okay, so let's take there's another CPS question here. Faded from Twitter says, wouldn't it make sense to reinstitute a mask mandate at Chicago Public Schools and advocate for the purchase of high-grade masks for all students with federal relief money prior to any potential BA2-driven wave? Okay, so on the second point, CPS has purchased, has in place, we've made sure of this, both adult and child size, high grade, best available, KN95 masks. Those are available to anybody who wants them. They are in good supply. So I have no concerns about that, and we'll maintain that. There is not a need to reinstate a mask mandate at this time in Chicago Public Schools. You won't find a single public health organization, whether it's the WHO, the CDC, the state health department, the local health department, the larger school community organizations, et cetera, that recommends universal masking when risk is this low. The positivity rate last week in Chicago Public Schools was less than 0.1% in the routine testing. I think it was something like 0.03%. So low. And they have a very robust testing program set up where there's thousands of kids getting tested. And in that way, we are able to monitor not just for cases that are symptomatic, but are we seeing cases that are asymptomatic? Are we seeing concerns there? Like this is a surveillance program in a lot of ways, and I want to thank the many parents and staff that have agreed to have their children tested at CPS and CPS for standing up this huge ongoing program. So the risk is low. It is not raining right now in Chicago Public Schools. If we see a surge, you've heard me say all along here that if we get to a yellow level, for example, like CDC defines it, we would probably be making recommendations for masks in indoor settings and potentially requirements in some higher risk settings. And if we got to red, we would be making requirements. CPS could choose to do a requirement at yellow, for example, if they made that decision. But there are public health recommendations based on risk, and there is not a need for the mask mandate. Remember, the masks start working from the moment you put them on. And so if we start to see concerns, we get to a point of more increased risk, not just schools, but other settings may decide to put those masks on. But right now, that risk is extraordinarily low. Lowest number of cases we've seen, lowest positivity we've seen, going all the way back to the beginning, of the school year. So that is my opinion, but it is a very, very, very common opinion across the public health community. Because the other thing is, if we say we got to put the mask back on, I want you to know that that is also based on data and risk and need. When we need the umbrella, we put it up. Okay. Question from Susan Villanosa about travel. Is there testing required for people visiting the country? Yes, and not just people visiting the country, but Americans who are returning to the United States. So if you have left the U.S. and you are returning to the U.S., you have to show proof of a negative COVID test, and that has to be done within 24 hours of when you return back. The other option is that if you have recovered from COVID in the past 90 days, and knowing that, remember, those PCR tests can stay positive for a long time. It does not mean you are infectious with COVID, but you could get into this tricky situation if you're diagnosed with COVID, you're feeling better, you're not infectious, you travel internationally 2 weeks later. So that's why I tell people, if you might be traveling internationally, please go and make sure you get a lab documented, PCR test, so you have that with you in case of travel. But otherwise, yes, everybody coming into the U.S. has to have a negative test. There's a comment here, TPK from Twitter says, worry about other chronic diseases destroying our minority populations. So TPK, I worry a lot about the disproportionate effect of chronic diseases on minority populations here in Chicago. The Chicago Department of Public Health, even before COVID, we had analyzed the racial life expectancy gap here in the city of Chicago, where even before COVID, Black Chicagoans, on average across the whole city, live 9 years shorter than white Chicagoans. Latinx Chicagoans seeing the greatest decreases in life expectancy. Asian Chicagoans seeing decreases in life expectancy. Unacceptable, preventable, and the biggest cause of that gap, chronic diseases. More than half of the life expectancy gap. And that's heart disease, diabetes, some of the cancers, et cetera. And here's the thing, though. During COVID, COVID went from something that had never killed anybody to the number 2 killer in the city of Chicago in the year 2020, it being a direct killer after cardiovascular disease. But we also saw that people who had diabetes and heart disease and other issues were also significantly more likely to get seriously ill or die from COVID. So, the health department continues to work a lot on making sure people who have, are getting screened for heart disease and diabetes, but it's also about root causes. It's about, do people have access to affordable, healthy food? Are people living in neighborhoods where it is safe and welcoming to exercise outside? Are there opportunities to access that primary preventive health care? If people are diagnosed, are they getting the medication and connections that they need? So it's not that we in any way have stopped being concerned about this, because there's the direct and the indirect effects of COVID. And we saw an increase in not just COVID deaths during the first year of COVID, and we're going to be releasing some more data on this in a few weeks. The epidemiologists right now are doing some analysis looking at some of the indirect effects of COVID. But we saw people with diabetes die more frequently, in the first year of COVID here in Chicago, where they were perhaps less connected to care, for example. So this is not an either or, but do I have a vaccine for diabetes? No. I wish I did. For heart disease? No. For drug overdoses, which are also up, for suicide, for homicide, for HIV, a lot of the other big killers and drivers of the life expectancy gap in Chicago, these are all intertwined. Vaccine is not the only answer even for COVID, but it is true that we have seen COVID hit the hardest in Black and Latinx communities. And we have seen, and I showed this data last week, that the more vaccinated communities are, the least likely they are to die from COVID. And so when I think about working on life expectancy and health, all of these things are important. This particular Facebook is very focused on COVID, but thank you for raising that, because it is, in a lot of ways, that life expectancy gap. That's our long-term goal. And it's about working on the root causes that I think people have noticed a lot more, or thought a lot more about during COVID. Terry from Facebook, do you think Moderna vaccine for kids under 5 will be approved before Pfizer? Yeah, so I've been watching this, and I know you have too. So let's just be clear where we are here. A couple days ago, Moderna released that in its trial of COVID vaccine for children under the age of 5, that the trial had met its primary endpoints, meaning that it was obviously safe, but that it was also effective in terms of having the same level of the neutralizing antibodies that are protective for COVID, especially severe outcomes, that was seen in older populations. And just to remind you, in case you haven't been following this closely, Pfizer has at all points here been a little bit ahead of Moderna in terms of, you can't rush this stuff. You've got to finish the laboratory research. You've got to do the phase 1 trial, which is the smaller safety trials. You've got to do the phase 2 trial where you're looking in more people. You've got to do the phase 3 trials, which are, giving real vaccine to some people and dummy vaccine, placebo, and saline injections to others, and seeing what develops. All of this takes the time that it takes. But what happened was Pfizer chose a dose for the kids under 5 that was very low, 1/10 of the adult dose. So they had no side effect problems at all, no issues with heart inflammation, nothing. That was great. But after 2 doses, they didn't see the level of those antibodies that they were really needing to see to be confident that this vaccine was effective. And so instead of sort of moving ahead for those youngest kids, they are looking at a 3rd dose right now for those youngest kids of Pfizer in that trial. And if that vaccine, it will, I'm sure the safety will continue to be very good, but if that effectiveness target is not met, then that vaccine would not be available for kids. That's how it works. If the FDA and the CDC don't give it the green light. Moderna chose a slightly higher dose. They used 1/4 of their adult dose instead of 1/10 of their adult dose. And these are hypotheses, but a lot of the scientists think that some of the dosing on Pfizer may have been a little bit on the conservative side. It's good because you don't have any of the concerns about side effects. But even in the older kids, we've seen more breakthroughs on the older edge of the 5 to 11-year-olds, for example. And in the study, the Pfizer study of the 6-month to 4-year-olds, it actually was good and protective for the little ones, the 6 months to 2-year-olds. It was kind of the older edge of that range where the kids are bigger, that the level of antibodies was not quite as high. So I think it is possible that we may see a Moderna vaccine possibly authorized for children under 5 before Pfizer. But remember, there's a lot that needs to be looked at before that. The FDA and the CDC will be looking at all of the data from this trial. The experts will be looking at it, and they'll be making recommendations. But I think it's possible that we may see, for this youngest group, Moderna come through first. But I know Pfizer is not that far from also being done with the kind of the 3rd dose part of its trial. So no vaccine yet for kids under 5, but that was very good news for those of you who have been anxious, and I'm feeling more optimistic than I was that hopefully in the next few months here we will have vaccine available for our youngest residents. Gutty Kapadia on Facebook says, any thoughts about a 4th shot for the immunocompromised? So let's talk about 4th shots. For people who are moderately or severely immunocompromised, meaning you see a doctor for this, you are on chemotherapy for cancer, you are on medications that help drop your immune system for an autoimmune disease, you otherwise see an immune specialist, a cancer specialist, etc. They're already, for those people who are moderately to severely immunocompromised, you should be talking to your doctor. They do additional tests, and it's not that the vaccine is more important, in fact, for people who are potentially immunocompromised, but there are people who don't mount enough of the immune response. Kind of like we were in the kids after the vaccine, they don't have quite as much immune protection. In this study, in people who are severely immunocompromised, they may not get as much immune protection. And so there are recommendations to do a fourth dose for people who are immunocompromised, but you should be talking to the specialist doctor that you see about that. For everybody else, there is not a recommendation at this point for a fourth dose. I have not gotten a fourth dose. I will not be getting a fourth dose until there is any, until the CDC, the FDA sort of look at some of this data. And at this point, we're not seeing a strong indication that there is need for it. Benjamin Vigilant on Facebook is asking a good question here. How concerned should I be if I do an activity now, like dining indoors, about long COVID? I've been vaccinated, and last July I had a breakthrough, so I know what a medium case can be like, but I'm worried about long-term harm less than a particularly bad week, which is what my illness felt like. Yeah, this is a really important question, and it's one of the ones that, I think, long COVID or what we see it called different things, post-COVID conditions is the broad term that we're using. It's one of the things that the most research is being done on across the country. The CDC has enrolled lots of people in studies, people who have long COVID, people who don't have long COVID. What is the difference between them? What have the risk factors been? And we are still learning about it. I will say overall, I think there seems to have been more risk for long COVID early, pre-vaccine, after sort of first exposures, et cetera. But I want to be careful because there are definitely still studies going on around this. So I have, in somebody who, first of all, I hope you are up to date with vaccines, not just vaccinated, but you got your booster, because you should. Like everybody who has any concerns, vaccine and booster, full stop. That's the most important thing. And I do think that in folks who are vaccinated, fully vaccinated and up to date, and who have recovered from COVID, I think the risk is lower, but I don't know that it's zero. And that's where, I don't want to over reassure you about this. The risk of dining indoors right now, of getting COVID at all, is also very low, though. And so in that combination, this is where, everybody is going to make a little bit of their own risk benefit. But for me, the risk is very low, the lowest it's been, honestly, right now, even as numbers are ticking up a little bit. The chance that when you are out and about, especially if the people you're dining with are also vaccinated, that you would be exposed to and acquire COVID in a setting like that is extremely low. It really is. It's not zero. It's probably never going to be zero. But in somebody who is fully vaccinated, and especially if you've recovered from COVID, I think the chance of you getting COVID is quite low. It's not zero. And then on top of that, I think the chance of you getting long COVID is lower than than it would have been at the beginning. So, I certainly have been dining indoors without significant concern. And my biggest thing I always look at is what is the risk level right now in Chicago, and it is low. So I hope that helps. Again, different people have different tolerances for risk. And I'm watching some of the long COVID studies with the most interest. And I talked more, if people have other questions, put them in. We talked more about long COVID, I think 2 episodes ago, if you want to go back. I shared what some of the studies are, what some of the, there's been some good things where, ideally you'd have a blood test that you could take and sort of say this person is higher risk for high COVID or low COVID. But it's pretty clear that having a higher level of COVID in your body like when you get COVID, seems to put you at risk for long COVID. And so if you've been vaccinated, if you've previously recovered from COVID, those both make you less likely to have the high viremia, the very high virus levels. So I think that may be part of what's going on, which would make you less likely to have long COVID. But I want to just caveat all that with that there are still studies happening here. And trust me, we're watching them closely, and I'll bring you updates as we get them. A question here, just a follow-up on ivermectin studies. Yes, there was a big study that came out about a week ago that was a multinational study, very high quality, lots and lots of settings, and found that ivermectin did not have any impact on preventing hospitalization, deaths, etc. So at this, ivermectin, you might recall, was kind of a controversial medication during the Omicron surge, and we didn't have evidence that it helped. We did have some evidence that it could harm. And as always, when there is a hypothesis, you want to do the study. And so that was a big, I think, very well done study, and it did not show that ivermectin helped. So I refer you, to that, or if you want to talk some more about it. But yeah, thanks for raising it. Trudy Long from Facebook, what contributed to the current COVID outbreak in China, and what can we do to avoid the same happening here? Yeah, so China's really interesting. China has been pursuing a zero COVID approach, and they've been doing that since the beginning of COVID. And they've been doing that with very aggressive COVID controls, locking down, really locking down cities with tens of millions of people, at the level that you may not leave, except for once a week to get groceries in a monitored kind of way. The problem I think that China is seeing, along with some other countries that were aiming for zero COVID, is that the Omicron variant is just too infectious. It's too contagious. And even where there have been cases and there's been attempts, and right now China is locking down huge cities, I want to make the point that one of the reasons for being very aggressive around lockdowns, et cetera, is to give time to get people vaccinated, right? And one of the reasons why, especially before vaccines were available and things were really out of control, there was more turn to this is because we saw what was happening. But China is pretty well vaccinated. There are some concerns about rural areas. Also, there are some vaccines, some Chinese vaccines that it's looking like may not be quite as protective. But I think the surge that you're seeing is a combination of just this very infectious Omicron, where it is coming in breakthrough. Hong Kong specifically, separate from China, Hong Kong is a really interesting case study because it also was being very aggressive in terms of, zero COVID, very tight lockdowns, et cetera. Everybody has to quarantine if you're coming in from outside. I mean, you saw during the Olympics the levels that were in place in China. And partly because there had been very, very few cases. I think partly because there is a lot of mistrust of the Chinese-made vaccines in Hong Kong, sort of for political reasons, and other kind of trust in government, this gets back to these decisions. Something like 2/3 of people who live in Hong Kong over 80 or 85 are actually not vaccinated. And it is in that setting that Hong Kong is seeing not just an enormous surge in cases, but literally, I was reading running out of coffins because you've got a very unvaccinated, high-risk population. And, it makes me think, if the original version of if the original version of COVID had looked like Omicron looks, and we had not had vaccines available, think about how bad this was and has been already. It would have been so much dramatically worse. So they are working hard to get folks vaccinated now, doing more requirements, incentivizing, et cetera. But I think it's a combination of just there having been very little COVID, so not a lot of exposure, still a lot of, there are some parts of the country that still are not vaccinated, and potentially some differences in terms of how the vaccine itself is performing. And so when I think about avoiding the same thing here, we are really different, and the whole West is different. I'm paying a little more attention kind of to Europe in a lot of ways when I'm thinking about what's different. And so to Chris King-Korkowski, saying, how will Europe affect us? So Europe is surging right now with BA2. And in case folks haven't been, last time we were on with Dr. Ganai, last Thursday, we did a whole thing about what's happening around the world and what's happening with different variants. And I refer you back if you want to see some of the science of variants. But they saw, a B1 spike like we did here in Omicron. And then before cases had come all the way back down to a controlled level, they saw BA2 really come in right behind that and drive a second surge. One of the things that I do, and I want to be clear that I do think some of the increase we're seeing here now, although it's very small, I think it will probably continue, and I think it is probably due to more BA2. But one thing that is really different in Europe, which is in a lot of ways, I think, where, as opposed to comparing to China, Europe not really heading for a zero policy, more in line with some of the mitigations to what has been done here. We saw at a time where levels were still relatively high, a lifting of masking, a lifting of other mitigations, and that lifting at the same time before numbers were down, I think also has contributed to the worsening of this surge. So I think we'll see some increase here from BA2, no doubt about it. But when you start at a very low level, you have a lot more space, honestly, from an epidemiologic perspective, to not see the really dramatic increases that have been seen there. So we're going to know more. And I feel like I say this a lot, but with the variants, as they keep changing and the subvariants, it's the big question mark. The three things that control whether we have surges is what happens with variants, what happens with behavior, and what happens with immunity. And immunity, combination of vaccine and some of the immunity if people have recovered from COVID. And immunity you can work on right now from a vaccination standpoint, and that's what we want to do. Behavior, we peaked here in Chicago, to be clear, the exact same time the UK peaked. The UK peaked January 3. We peaked, I think, January 2, depending, in our Omicron surge, our original Omicron surge. And we are, the UK right now is at like a 13% positivity, very high numbers, is seeing some increase in hospitalization. We've seen nothing like that yet. Could we see something? Yeah, we could. And that's what we're monitoring for. But I remain pleased about the fact that we waited to lift requirements until we were in a safe place to lift them. And knowing that if we really need them, we'll put them back on again. But I don't want to have to do it hopefully we won't need it. But we'll see. We'll see how this transpires. Okay. Oh my goodness, this time has passed so fast. I didn't realize we were just about at time. Let me hit a couple just really quickly. Faith stayed on Facebook. Will the city continue to have free tests and vaccines? Yes, definitely the city, regardless of insurance status, we will never turn somebody away to get vaccinated. Even before COVID, when we do vaccinations, if people are uninsured, we play an important sort of safety net role there. I think on testing, we have some free testing available. For people who are uninsured, federally qualified health centers, please, please, please get connected to one now. These are your community health centers in your neighborhoods. They get additional federal funding to provide care, free testing, free treatment, free vaccination, specifically for folks who are uninsured. And I want you to be connected now so that if you get COVID, we can make sure you can get those treatments at a place regardless of your insurance status. But yes, we have been filling in gaps all along here around testing, and will continue to do so while that gets sorted. And just quickly, Susan Villanosa on Facebook, should young women and young girls get boosters? I've heard that some are reporting menstrual irregularities. Yes, women and young girls over the age of 12, which is who boosters are approved for, I definitely recommend that they get boosters. The menstrual irregularities has been studied, and actually maybe I'll bring that next time we come, because some of the initial study was actually done here in Chicago and they've looked at it. There's not been any evidence of any menstrual irregularity that is in any way sustained or causes issues. There is a small percentage of people, I think partly because we're looking at entire populations, that see a slight change in their period in the month right around when they are getting vaccinated. But I'll bring the data on that. This does not affect ovaries. It does, some of the other things that go along with it. So I have, and most women and young girls don't have any change in menstruation. So I will bring one of the studies about that next week, because it's a good question and I want to be able to give you some data about it. But suffice it to say that I very strongly recommend that women and girls do get the booster. And if you've got any underlying condition, definitely get the booster. And if you're pregnant, definitely get the booster, because yeah, those can be risks. So, all right, we will be on one day next week, either Tuesday or Thursday. We're still kind of working out a little bit as the situation is changing, exactly when we might do stand-ups, when we might do press conferences, but follow the Chicago Department of Public Health on Facebook, on Twitter, on whatever, and we are putting there when we're doing these live and trying to do that in advance. Keep sending in your questions, we'll get them, and I actually just want to end with saying Happy World Tuberculosis Day. Great job to our tuberculosis team at the Chicago Department of Public Health that throughout COVID has continued to make sure that people who get tuberculosis in Chicago, and yes, people still get tuberculosis in Chicago, that they are treated, that we don't see spread of TB here. And there's a lot of things that the health department does that I think people don't know about, and tuberculosis is probably one of them. And so I got my international career start in some ways working on tuberculosis. My first job with the CDC was in Botswana as part of a research team, spending a year helping with a big study looking at TB and HIV, and tuberculosis remains one of the major killers in the world. Almost 1 in 3 people in the world have been infected with tuberculosis. Doesn't mean they're sick from it. And we are a global city, and people come and we make sure that if they are at higher risk for tuberculosis, they can get the treatment that decreases their risk. And if they develop active tuberculosis, that we are getting care. We house anybody who has tuberculosis here. The city actually pays for that housing and that support. It can take 9 months or a year or sometimes even longer to treat tuberculosis, but it is curable, and we follow people to cure because TB used to be one of the main things that killed people here in Chicago too. And it's something that we work hard to keep in good control. So happy World TB Day. Thanks for tuning in around COVID. And we will likely be back one of the days next week, a little bit to be determined. In the meantime, keep sending your questions, be well. And thanks so much for all of your really good and thoughtful questions today. Bye-bye.